you don't know me, my name is Teri Dale. I'm a functional diagnostic nutritionist and holistic health practitioner, author of two best-selling books. I'll tell you a little bit about that in a little bit. But I'm glad you're here because if you're in my Facebook group, I don't know if you guys found me through the Facebook group or just my Facebook page. Either way, if you're not in my Facebook group, I would recommend that I can put the link in here in the chat, maybe at the end of the call, to get in my Facebook group, because that is where I do play all the classes. I don't play them on my page. Again, more so that I have control over who sees what, because Facebook is really, they're coming down on us holistic people, because we are getting results for our patients, our clients, and we're using non-medical, non-drug therapeutics. And, Facebook doesn't like that because pharmaceuticals and the FDA, they want to make money. And I'll talk about this a little bit tonight, but a lot of people who come work with me have been in the medical allopathic model, seeing their doctors, going to their doctors for 10, 15, 20, 25 years, and they're not getting any better, because all doctors know what to do is diagnose and treat with drugs. That's it. They don't get any nutrition or holistic training in med school. So what does that tell you? So we are currently in a very corrupt medical system, and I've been teaching and preaching holistic therapeutics for many years, going on 20 some years. And it's just amazing what my clients do when they actually kind of fire their doctor, fire their MD. That's kind of what I help women do, is fire their MDs. Because the goal for anybody that comes to work with me is to be able to only go to their doctor when it's an emergency, like you get in a car accident, have an infection, whatever, an emergency, right? And number two, just to get lab work done. Because I want to teach you guys how to read your lab work, and then what that means, what the lab work means, and then how to get you on holistic therapeutics, holistic protocols, therapeutics, same kind of thing, that will help your body to heal, because our bodies want to be healthy, but they can't be healthy when you're on medications. They can't. Medications never cure. They can't cure. Only thing that cures is your own innate intelligence and giving your body what it needs through holistic therapeutics, nutrition, supplements, foods. I'm going to talk a little bit tonight about some peptides. So, that is what works. And I will never stop preaching this. I will never, ever, ever, ever agree with a medical doctor on how he diagnoses and treats diabetes or even insulin resistance, or most women who are going through perimenopause and menopause. They're insulin resistant, which is like a prediabetes, right? When you get diagnosed with prediabetes or diabetes, they look at your A1C. So if you have an A1C of 5.7, you're pre-diabetic. Okay. Even 5.6, some doctors will diagnose you as prediabetes. But diabetes is diabetes is diabetes, because once you get that diagnosis, which they look at the A1C, then here comes the path of what they do for treatments. Here comes the metformin, here comes the insulin, here comes the glipizide. And then you gain all the weight while you're taking the medications, and then, okay, here comes Ozempic. So tonight we're going to talk about Ozempic, because this is going to be especially for those of you who have been on it in the past, or are thinking about going on it, or are on it now. And we'll talk about all three scenarios, but if you're on it now, hopefully tonight, you will understand why you need to get off of it and why there's a better option. We're going to talk about that. That's what this whole presentation is about, because I have so many women that are on Ozempic and it's just ruining their health. It's not working. It's not lowering their blood sugars, and they're not losing weight, and they just feel like crap. So we're going to talk about that, because why is it working for some people? Some people it's working. Some people, you see all the celebrities on Ozempic, right? And they've got the Ozempic face. You see what's her name? Ozzy Osbourne's wife. What's her name? I can't remember. Sharon Osbourne. I mean, she's got, she looks terrible because she's been on Ozempic. She's ruined her health. And now if she ever goes off of it, we're going to talk about what happens when you go off of it. But the longer she's on it, stomach cancer is going to happen eventually for her if she's still on it. and some other things that we'll talk about here in a little bit. So hopefully tonight, if you're, this is not a scare tactic class. So if you're on Ozempic, this is not to scare you and to say, but it's to educate you. Okay. And also if you're planning to go on it, hopefully I will do my job tonight to be able to share with you and teach you there's way healthier and better options that you can do and try that are healthier, that will do better, get you better results than Ozempic. Ozempic it's really bad and it's such a moneymaker. And that's why so many people are on it because they will lose weight. But it's not the kind of weight that is the good weight. You're losing fat, muscle, and then you're damaging your entire cellular system, your gut, your stomach digestion, and you're just real in neurological, you're really damaging your health. So for those of you who are brand new to me, I have been doing this work for, like I said, about 20, 25 years. I've been, my whole life, I've been a student of health. And the thing that really made me an amazing holistic health practitioner was my own health journey. I was diagnosed with cancer 10 years ago. And I just want to explain this just real quick because when I got diagnosed with cancer, I had been preaching nutrition, preaching health, preaching, and I got cancer. So when I got it, I was not only shocked, but I was scared because I'm like, if somebody like me can get cancer when I'm eating clean and doing everything I teach and, taking all the supplements, how does somebody like me get cancer? So it was daunting. It was scary. It's probably similar to when some of you get diagnosed with diabetes. I'm sure you're just like freaking out and scared. However, with the cancer, their only answer, their only treatment, their only solution when you have cancer is to immediately put you on chemo and radiation. And I wasn't going to do that. I had already made a decision not to do chemo and radiation. I didn't know anything about cancer because I was working with women who had needed to lose weight, insulin resistance, and diabetes. So when I got diagnosed with cancer, I'm like, I don't know anything about cancer. So that sparked my journey to learn about cancer. And I was able to reverse my cancer without any chemo or radiation. And that was 10 years ago. And now I have, part of my system, my program that I teach in is an anti-cancer protocol system also. But the only reason I share that is because we're not, just because you might think you're doing the right things, um, you're not a special snowflake that you can't get sick, right? But if you understand what's causing it. So I'm really a big advocate of understanding the why. So now I am not afraid my cancer is ever going to come back because I understand it. With diabetes, same thing. I'm never going to get diabetes. Never. I will never get it because I understand how you get it. And so that is what I teach, right? Is I teach you guys how to get off the medications because you guys, the diabetes medications are actually what are making you worse. And there's a system. I mean, think about this. Really think about this. Some of you who might have had diabetes for 10, 15, 20, 25 years, and you've never gotten better. So if the doctors knew how to do it, you wouldn't still have diabetes. Clients that come to work with me and stick with me and learn the system and practice and continue to practice the system, they'll reverse their diabetes and keep the diabetes reversed forever. No, it's not easy work, but it can be done with the holistic, protocols and therapeutics that I teach. But if you're depending on your MD for medical treatments, you'll never cure anything because medications can't cure. So I wrote a book about my cancer journey, and you guys actually in my Facebook group, I have a downloadable PDF of I Refuse Chemo. You can read my personal story. It's very intimate. I share everything. It's a very vulnerable book because, I went through a lot. It was a lot of emotion that happened to me. Actually, I had a lot of shame, to be very honest with you. And maybe some of you feel that way about even your diabetes, but I had a lot of shame because I kept thinking, how does somebody like me who's this expert in nutrition get diabetes, or get cancer. But here's now, looking back, here's what I know. I was given that for a reason because now I know how to reverse it. And I know how to help women who are in that crisis mode, in that real scared place. I understand. This is why I'm so good at what I do because I've been through it myself. And you know what the best thing about diabetes or even cancer is that it's the relief. Like I'm not on any medications, right? I'm not scared of cancer coming back. I'm not scared of diabetes because I understand the body through everything I've been through. So I believe that the Lord gave me cancer for a reason. I believe, my whole business, my whole ministry is helping women to reverse their diabetes and help them with anti-cancer protocols. This is my ministry. And so looking back, I'm so glad it happened because it just made me so much better and made my information that I give you guys so much stronger. So I don't regret that it happened. I don't look back at it as a terrible thing. At the time, at the time it wasn't, it was scary, but I was able to, like I said, able to really work through all that. And now I use it as fuel to help you guys because I know I recorded the entire conversation with the oncologist because I did go to my oncologist because I wanted to, even though I had made a decision to not do chemo, I wanted to hear what the oncologist had to say. And I recorded it, audio recorded it, because I knew I was so scared. I knew I wouldn't remember anything. And the things that stood out to me the most were I had already made a decision to do holistic therapeutics. But when I asked her, it was a her, about these holistic therapeutics, she knew nothing about it. And she told me this, Teri, she says, I cannot give you any holistic advice. If I do, one, she said, if I do, I will lose my medical license. And two, I don't know. We can't study it. We will lose our medical license if we try to even study. The only thing I can do is give you, go down the hall, sign up for chemo, go look at wigs, and start your radiation and chemo. So I understand, but some of you, and that's what some of you guys, when you go to your doctor for diabetes, they're like, nope, you got to take metformin. You got to take insulin. And then you go on that for a few weeks, you feel like crap, and then you go back to the doctor in 3 to 6 months, and your numbers aren't better. So then what do? Add more medication, change the medication, or increase it. I know this. I know how it works. So I empower women to understand this stuff and learn this stuff. And you have to invest time and money into your health, or you're not going to have health. And this is a strong statement, but you guys have to understand this. If you don't take the time you're spending $400, $500, $600, $700, $800 on insurance to get you sicker, or on medications or whatever, right? It's a corrupt system, and the only person that's benefiting are your doctors and the insurance companies and and the pharmaceuticals. So just know that I'm glad you guys are here, and I'm very opinionated about this, and so if this kind of turns you guys off, I'm sorry. I'm maybe not the right fit for you, and maybe this isn't the place for you, but I will never stop teaching and preaching holistic because it works. Not only in myself, but I've had thousands of clients that it's worked for. So I have 2 Amazon best-selling books. I Refuse Chemo is also in bookstores around, but you can get both of these books on Amazon, or I have PDF copies inside the group that you can download. So the Refuse Diabetes is also a 9-step process that I use to help you guys reverse your prediabetes and your type 2. Okay. But tonight, let's get to the topic. So tonight I want to talk about Ozempic because Ozempic is the main, it used to be the main drug that they use for diabetes, but then because it wasn't working for diabetes, they decided, oh, let's give it to non-diabetics for weight loss. And then you heard, a few years ago, the buzz was, let's give it to celebrities. And all these celebrities are starting to lose all this weight. You've seen Oprah. Have you seen a picture of Oprah lately? She looks like she's never been this thin. And she looks great. However, she's ruined her whole cellular system. And so we'll get into that. But Ozempic is a glucagon-like peptide. It is a peptide, GLP-1 receptor agonist. But it's Ozempic, what they do is they take that peptide and they drug it, meaning they add certain pharmaceutical spin to it, right? So it's not it's not the kind of GLP-1 that I recommend for peptides, but Ozempic is a pharmaceutical. And you so that's what it's classed. It's classed as a GLP-1 drug, and it stimulates the insulin release from the pancreas. So this is why, you know, for women who have diabetes, it doesn't really work very well because you're already have hormone and receptor problems. So the biggest reason why this works is because it suppresses your appetite. It's a weekly injection, and this is what it does. This is why people lose weight. They don't lose weight because it's actually working to fix your cellular fat burning process. It works because it slows down your stomach emptying. So the active ingredient in Ozempic is semaglutide, which works by inducing satiety, this feeling of being satisfied or full, suppresses appetite. And so this works well for weight loss initially, but it also helps the pancreas produce insulin. But here's the key, right? When you have a lot of insulin in your body, it shuts down your fat burning, right? So the main reason why people are losing on this is because it is slowing down their gastric emptying. So when you are a diabetic and your insulin is high, it shuts down, like I said, it blocks the body's ability to burn fat. So the only reason why people are losing weight on Ozempic is because the metabolic slowdown of them not eating. And so you're losing muscle. So a lot of the weight that you're losing some fat, but you're losing a lot of muscle. So doctors prescribe Ozempic to help you lose weight. And they make a lot of money on it. If you're paying out of pocket, you know how expensive it is, but most insurance will cover some of it. I was just talking to a lady today, though, who her insurance didn't cover it, and out of pocket, she was paying like $600 a month for her drugs. And I'm like, man, paying $600 for you to get sicker, that doesn't make any sense to me. So, even though it's illegal to give kickbacks to a doctor to prescribe drugs, it is legal to give money to doctors to help promote a drug. So some doctors make tens of thousands or hundreds of thousands of dollars a year beyond their normal practice just for working with the industry. I'm going to tell you something, a side note here about cancer. What I learned about cancer is there actually is a kickback for cancer drugs. So when I was there and the oncologist, I learned that if I would assign the dotted line that day to do chemo, they get immediately from the pharmaceutical company that sells the chemo, the type of chemo, they get between $5,000 and $10,000 in their pocket. The oncologist does. And I know this as a fact because I do. And so no wonder why when you get diagnosed, no wonder why when you get diagnosed with cancer, the oncologists are so pushy to get you on chemo. It's about the money. If they really cared, they would say, listen, here's what a good oncologist should do. A good oncologist to say, here's your options that we have medically. But if I were you, I would also research holistic options. Here's a great resource, me or whatever. Here's somebody to just take a look at and study. Look at them both, compare and contrast the two options. That's what a good oncologist should do, but they will not do that. Mine didn't. She was like, you don't mess with this. You better get on, chemo and radiation right away. You're too young to be messing with this. I'm like, no way. I left that. I ran out of that office so fast. It was horrible. But she was motivated, very nice. She's a really, really nice lady. And she was honest with me. She said, I can't help you holistically. I'll lose my license if I even research or learn about that. And she wanted me to do chemo and radiation so she could get, a few $1,000s in her pocket. So it's a corrupt industry for sure. Okay. But here's the dangers about Ozempic that your doctors just don't tell you. It causes gastrointestinal damage, permanent damage. Okay. So not only do you get side effects of the drug, okay, but the longer you're on it, the longer you're doing the damage. And eventually your stomach will be paralyzed. It will be paralyzed. And so then here comes the pancreatitis, here comes cancer, kidney injuries, and eventually stomach cancer. Now I want to talk about the stomach paralysis here for a little bit, okay? So this is why a lot of women who have been on Ozempic for 1, 2, 3 years and it's not working. They haven't lost weight. They just feel like crap, and they come to me because it's not working. But here's the scary part: is that um, women who, let's say they go off, let's say they've lost the weight. Okay, let's say they lost 40, 50, 60 pounds, and they want to go off Ozempic because they understand it's not a drug that they should be on forever. They want to go off it. Okay. Well, they've damaged their gut permanently. To what extent kind of depends on the person, depends on how bad how the dose that they had, but they've done some permanent damage to their gastrointestinal tract, their stomach, paralyzed their stomach. So now here's what happens. Let's say they try to eat healthy. Okay. So they try to eat fruits and vegetables and really eat like an cancer, anti-diabetes diet. Well, healthy food requires your body to digest. And now they can't digest the food because Ozempic has ruined that process for them. So they feel horrible when they eat. They get nauseous, they throw up, they're having all these problems. They can't eat. So what do? They eat crappy food again. So they eat the sugar, the high processed food, because that digests. You don't need a lot of digestive energy to digest crappy food. That's why processed food is it's so cheap, because it's cheap and it digests, But here's what happens when they do that. So they can't eat the healthy food. So they go back and eat the processed crap because that's the only thing that they can somewhat digest. So what happens? Here come their A1Cs back up. Here come their blood sugars back up. Here comes their weight, because now they're just putting back the weight back on that they lost with Ozempic. And now they've lost a muscle, so trying to get it off is going to be even near impossible. So that's the scariest part about Ozempic. And when you're on it, you will do permanent damage because of the dosing of it and how what they put in it. So some of the side effects are nausea, vomiting, diarrhea, constipation, abdominal pain once it gets to that point where it's starting to paralyze your stomach. And then that can lead to also dehydration and electrolyte imbalance. There is a huge risk, like a very likely high risk of developing acute pancreatitis. It's an inflammation of the pancreas, which can be life-threatening, and it's painful. I've talked to women who've had this. It's extremely painful, and it's very hard to reverse with medication. But there are some ways that you can do it with peptides, but with medication, it's impossible. It's impossible to reverse. Thyroid cancer, also, there's been lots of studies linked to Ozempic increasing the risks of cancer in your thyroid, also kidney injuries and kidney damage. Now, the long-term effects, like long-term effects, besides the damage and the paralyzing of your stomach, it can increase the rise of heart attack and stroke with long-term use. So that's a cardiovascular risk. That's very, very bad. Has neurological effects. There's been reports of neurological side effects, including confusion, dizziness, headaches, and shakiness. It's not good. Bone health. Prolonged use will affect bone metabolism and increase of fractures, especially in women. Because why? You can't eat. You can't eat when you're on Ozempic, and you're not absorbing anything. So even if you're taking supplements, the Ozempic and the insulin, because your body's going to be in kind of inflammatory mode, it's not absorbing any of the calcium the high doses of calcium your doctor are putting on, which doesn't work anyway, but that's a whole nother topic. So again, the biggest issue I see is the delayed gastric emptying. It slows down your gastric emptying. Food remains in the stomach longer, leading to digestive issues, nutrient malabsorption, and discomfort. Okay. So it also causes microbiome disruption. Basically, it's the intestinal mobility. That's the part that gets paralyzed. And then you can't absorb anything. So, I always tell women when they're on Ozempic, they're telling me, they'll say to me when I'm interviewing them or I'm talking to them, they're like, yeah, I've been on Ozempic for a year and, I've lost only 10 pounds, but my blood sugars aren't any better, and they're getting worse. And the biggest thing they'll tell me too is, like it's not working. And they'll tell me I'm on all these supplements, I'm on, vitamin D and a multivitamin and all this stuff. And they feel like fatigue and they feel like crap. And I'll be like, well, this is why. But so they'll be on all these supplements, and I'll tell them, well, listen, you are spending money on these supplements and you're not even absorbing them. Because when you take Ozempic, you don't absorb any nutrition. Okay. And then if you go off of it and you try to take supplements, you're gonna feel nauseous because of the damage that's been done. So Ozempic and supplements, it's a waste. It's just a waste of money. So there's the lie that your doctors have been telling you that you can use Ozempic for weight loss. Um, and that's the lie because there's a risk reward, right? You might lose some weight. Some women don't lose any weight, but some might lose some, right? And then the risk is that, okay, the benefit is you might lose some weight, but the risk is the long-term effects. And that's very scary. And you guys just need to learn about this stuff because the doctors aren't going to ever tell you this because they're making too much money. Okay. So again, the intestinal motility disorders like the constipation, the watery bowels. Because listen, if you don't digest your food, it's causing that food in your colon to rot. That's why if you have bloating or constipation, if you're not going to the bathroom every day like a normal bowel, you've got you've got constipation issues and you've got food that's being rotted and sticking in your colon. And then you end up getting colon cancer probably down the road, right? Because that food, it rots and then there gets a bunch of bacteria in there. And then there you go. Then it gets worse and worse. So you got to be going to the bathroom every day, but you don't want diarrhea and you don't want to be constipated. So you have to understand that it's a big issue. And I already talked about this, but male absorption of nutrients is a huge problem with it. Okay. So the longer you stay on Ozempic, eventually you will get gastroparesis, you will have stomach paralysis, and then your long-term stomach cancers will develop from it because of all that. Okay. So, but you can gain your weight back too on it. And that's the problem. I get that question a lot too. And I already explained why. Because once you go off of it, you can't eat because you can't digest food. So what do? You eat processed food, sugars, and there goes your weight back up because now you're eating all the sugar and your metabolic rate has slowed way down. So you're putting all these sugary, bad processed foods in and toxins and all that. Just, you gain all your weight back. Your diabetes comes back. As you can see, not a big fan of Ozempic because it's a drug that the pharmaceuticals have made into a high dose GLP-1 with added stuff to it that makes it very hazardous to your health. So I want to talk about, your own innate intelligence of the body. Your own innate intelligence of the body knows how to heal itself, okay? Your pancreas knows how to produce insulin when your blood sugars are high. Your heart knows how to heal itself if you give it the right environment. Your diabetes can reverse if you give it the right environment. Your cancer can heal if you give it the right environment. So our bodies are designed to be healthy, you guys. Okay, when you were born, unless you had a genetic problem, when you were born, you were healthy. And diabetes is a lifestyle disease. Diabetes is not genetic. It's not inherited. It's not genetic. Now, if you've type 1, that's different. If you get diagnosed with type 1 between the age of a baby and 3 years old, that's a genetic thing. But if you get, if your diabetes turns into type 1 when you're 30 years old, that's not genetic. That was because you've had type 2 for so long and it can turn into type 1. And that's what you don't want. You don't want your diabetes to turn into a type 1 or 1.5. So, so our bodies are designed to be healthy when we give it what it needs. The innate intelligence of the body is amazing, you guys. Like, how does it know how to, when you get a cut, let's say, right? You get a cut and it immediately knows how to heal and not scar. And it immediately knows how to do that. When you have the flu, your immune system knows how to heal that, like how to fight off that. When we give it all these drugs all the time, and all these things that prevent our body from naturally doing what it's designed to do, our immune system, you guys, is designed to fight off infections and viruses and COVID. Don't even get me going on the vaccine because that was a big scam. And I know a lot of you had to take it because of work. I get it. But, I the whole time I've been working on my immune system so that that my body will fight off flus and infections. And I can't remember the last time I was ever on antibiotics, right? I mean, I think the only time I was on an antibiotic was when I had surgery a long time ago, like 25 years ago, right? Um, or maybe when I had a tooth that was infected. I don't even, it was so long ago. Point is I don't go on drugs and antibiotics or anything because again, the only time I want to see my doctor is when I go get my lab work done so that I can read my labs and whatever. But they want to always put you on medication. They corrupt the system. Okay. What I want to teach you and what you guys have to learn is you have to learn how the body works without the medication because you cannot cure or get better with medications. Now, before I go any farther, some medications short term are just fine. I get it. Like, thank God for insulin. If you have type 1 diabetes, thank God for insulin. Of course, you need to be on insulin. But even doctors over medicate insulin to type 1s. And there's a way you can still give the body what it needs without having overdose of it. So my point is that there's a time and place for medications, but your goal should never try to be on a medication long term. That should never be the goal. But your doctors will never tell you that. And they don't know how to do that. Okay. So you have to take it upon yourself to learn this stuff. And it's challenging. So I want to talk tonight about, I know I said that I wanted to talk to you guys about a better way that you can, that you can, you know, not have the side effects of Ozempic by getting off of it. Because look at these, look at all these side effects. It's like terrible. And maybe some of you who have been on Ozempic can identify with some of these. If you don't have any of these, I would be super surprised because I've never talked to anybody who hasn't had side effects from Ozempic, never. But it's never just one thing that's caused your diabetes or your weight gain, you guys. It's never just one thing. So what I want to talk to you about tonight is the three biological fundamental root failures of our bodies. And this is, MDs don't know this stuff because all MDs do is you go in and they diagnose and they want to give you drugs. They are drug experts. They're pharmaceutical experts. They're not health experts at all. I mean, you go to your doctor because you have heartburn, and the first thing he does is want to put you on antacids and anti heartburn medication. Acid reflux is one of the easiest things to fix holistically, and they're giving you antacid, which is the opposite of what you should be getting. So they are not they're not going to ever know what the body needs. They don't even believe in supplements. And listen, I love supplements, but if your insulin is high, if you have type 2 diabetes and your insulin's high, or you're on Ozempic, you're on certain drugs, the drugs block the absorption of most of your healthy supplements anyway. And then there's also the subject of the quality of supplements. I mean, if you're paying $10 at Walmart for some vitamins, those aren't good vitamins. So you're not only are you getting crappy quality of vitamins, but now you're not even absorbing them. So it's important for you guys to understand that, you pay for what you get, right? And so if you guys are depending on your insurance to pay for your drugs, okay, your insurance is paying for you to get sicker. So, I get a lot of that. I get it. I get a lot of women that say, well, my insurance covers it. I'm like, okay, well, then keep doing that because you're just going to get sicker. There's got to be a time, it's like people will spend money on cars and cell phones and, all this stuff that doesn't help them to get healthier. So why don't people put an effort into investing in their house? And you guys all buy houses and you have apartments, you put money into things that are important to you. But this is the one thing that just frustrates me. It's like, why don't we see ourselves as important to invest in? Because you can't, if you don't have a good quality of life because you're on 15 medications, 5, 10, 15 medications, and you have side effects and you're living that way every day, are you really, I mean, is it worth it to live that way when you can have a solution by investing in yourself to learn this stuff? That's always been something I've never really understood. It's because people are putting a dollar sign with learning about their health. It's like, no, it's like you're the biggest investment. You're the biggest investment, your health. Like the peace of mind that I have knowing that I am not scared of going to my doctor. I'm not scared of going to my doctor. I'm not scared that my cancer is going to come back. I'm not ever going to get diabetes. I'm just because I know that I never will because I'm that confident and because I know how the body works. And that's the kind of things I want to teach you guys and that you have access to that. You have access to learn this stuff. Okay. So there's three things that you can do to lose weight, lower your A1C, and reverse your diabetes forever. And you have to do all these three things. And this is what you have to do. So the first one's a given. You got to change your diet, right? I mean, honestly, you got to eat high quality foods. Now, if you're on Ozempic, you're not going to be able to eat high quality foods because you can't digest them. And so you're going to feel miserable. But get off Ozempic, start eating high quality foods. You know, this isn't real food. You should never buy anything in a box that's processed. It's just not real food. Okay. So there's natural foods that increase GLP-1s, right? Naturally, and it's protein-rich foods, high fiber foods, bitter foods, healthy fats, fermented foods. Those are natural foods that kind of increase and cause that satiate, being satiated. But again, it's going to help keeping you full, right? And then also low calories don't mean low insulin. So I have a lot of women that'll say, "Oh, well, I'm cutting back on, my ice cream. I'm doing low calorie ice cream versus, the high fat." Well, low calories doesn't mean low insulin because usually if it's low calorie or low sugar, they've added tons of bad ingredients to it to make it taste good, right? So chemicals are just as have a negative effect on your physiology and your cells as Ozempic, as medications. So medications are terrible, but toxic ingredients also affect you. Okay. So I always look at this, like I always tell my clients to use this as a visual. Every time you put something in your mouth, are you feeding disease? So are you making your cells inflamed? Are you creating inflammation? Are you, is your body recognize that food as a nutrient? So you're feeding disease or are you feeding your health? There's only two ways. Your body doesn't know moderation, you guys. Your body doesn't know moderation. It's one or the other. You're either putting stuff in because you don't know how to eat, right? And you're not aware and not educated enough on what your body should have, or you got cravings that are so bad that you just can't help it, which I understand too. And that's going to always feed your inflammation, or you're feeding your health, which is your body is recognizing the phytonutrients and the vitamins and minerals that are in healthy foods. Okay, so that's your only options. There's no in between. That's the truth. Then number two, you have to find the underlying root cause. Okay, and this is what I want to talk to you guys about tonight. How there's three root biological failures that happen inside of our bodies. One is systemic inflammation. The next one is insulin resistance, and the third one is mitochondrial damage. So let's talk about the first one, systemic inflammation. Systemic inflammation is your immune system is in a low-grade panic, attacking everything it can find. So if you've been diagnosed with diabetes, you have systemic inflammation. If you have any aches and pains in your body, you have inflammation. In fact, we are inflamed because we can't control the air we breathe, the chemicals in our water half the time, and certain things we can't control. So it's like a brewing fire, like, especially if you got diabetes and you're on all these medications because the medications are causing inflammation. If you're drinking tap water, that's causing inflammation. If you're eating the wrong foods, that's causing inflammation. If you're, not sleeping well, you're not getting enough sleep, all that's caused, your body is just raising with systemic inflammation, and that's breaking down the systems of the body. So that's the first one. Number two, insulin resistance is the second thing that breaks down. And this is where your cells cannot hear insulin anymore. And listen, most women have this, especially if you are not even if you're diabetic. I work with a lot of women who come to me who have not been diagnosed with diabetes, but they just can't lose weight no matter what they try. They're perimenopausal, menopausal, and they think it's a hormone issue, and then they want to go on all these hormones. It's like, no, 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 you're insulin resistant because that's one of the three biological failures that happen as we age and as we keep the inflammation keeps rising. So, so insulin resistance is when your cells cannot hear insulin anymore. So on every cell, we have trillions of cells in our body, and every cell has receptors, okay? And these receptors, we have an insulin receptor, we have a testosterone receptor, we have an estrogen receptor, we've got a thyroid hormone receptors, we got receptors on the cell. Well, when inflammation gets high, and it basically and insulin, high insulin, by the way, is also inflammatory. So when you have high insulin and we have all this inflammation, now when insulin tries to push the sugar into the cell, which is what diabetes is the sugar can't enter the cell. So insulin's job is to push it in the cell. But when you have insulin resistance, the insulin tries to hit the cell, it can't get in. It's resistant to it. So does it make sense when a doctor puts you on insulin and you're insulin resistant? No wonder why you're feeling like crap. The insulin doesn't work. Doctors will put you on insulin and your blood sugars are still high. Why is that? Because the insulin's not getting in the cell. You got to fix the cell. So these three things that are happening are causing failure. The signaling in your cells are wrong. Okay, so that's insulin resistance. That's number two. And then the third one is mitochondrial damage. Now, we have in our cells, inside the cells, we also have ATP, which is mitochondria, which produces energy. So if there's no energy in the cell, and if you have cellular insulin resistance, nothing can get in the cell. So the vitamins, the minerals, nothing can get inside the cell. So then you also have an energy shortage because the ATP inside the mitochondria isn't working. So there's no energy. You can't have any energy to heal your body. This is why a lot of you get infections and you're sick all the time. It's why you're not thinking clearly, right? So most people have one or all three of these. And so it's a very serious thing, right? So, and the causes of these biological failures, here's the cause of them. One, age. As we age, our cells just get weak and they get, from the inflammation, they start to get weak. Years of processed food and bad eating. Diabetes, any disease will cause one of these biological failures, systemic inflammation, insulin resistance, or mitochondrial damage. Medications. This is why I'm not a fan of medications, because most people think medications help. They don't. Medications will put a Band-Aid over a symptom for a short period of time, but long-term effects of medication cause inflammatory response. Why is it? Why do you think that when you go to your doctor and the meds aren't working, they switch to another one or they increase it? They wouldn't have to increase it if they were working. They wouldn't have to switch it if they were working. They don't work. So I don't know of any doctor. I've worked with thousands of women, and I don't know of any doctor that knows how to get you off of medications the right way, right? So and listen, I'm not immune from this. I'm getting older, right? Now I don't eat processed food, so that's not my problem. But, I have to really watch what I eat. I have to, I have an air purification system in my house. I have a ROS system for, I don't ever drink any water out of a faucet ever. I bring my water with me everywhere. I have a reverse osmosis and I bring a water bottle when I go to restaurants. I don't drink any tap water at all because I know how harmful and how bad that is, right? I make sure that I'm taking everything I need nutritionally, because I don't have an absorption problem. So I take supplements that I know I'm absorbing. I'm not on medications. And I really check my toxicity. Now, I have a story for you that I will share, and which is why I am such a big fan of peptides. And I want to talk about peptides. So that's number 3. So we have number 1 was change your diet. Number 2, you have to understand what the 3 biological failures are. And if you're in this webinar tonight, you have one or all 3. I'm pretty sure, right? So we have to determine kind of what will happen when you have one of those 3, and then you have to start a plan to fix those. And the thing that I have found that works the best, besides understanding the nutrition piece of it and the supplement piece of it, is peptides. Now, I want to explain what peptides are. Okay, peptides are different from medication. So all y'all here, you might have heard some buzz about peptides. There's so many Insta guru, Insta people and influencers that are talking about peptides. They don't know what the frick they're talking about, to be honest with you. They're just talking peptides because they want to sell them. Okay. I'm going to give you the facts tonight. I'm going to tell you the truth. Okay. Peptides are amazing. They're amazing. But you have to know, you have to have somebody like me who understands how to use them. I've been using them. I understand them. I've hired, you know, been taking, certifications and classes, so I understand them. I've been working with people who know a lot about them. And so I'm not, influencer, a 20-year-old influencer who, is selling peptides and making a lot of money on them. There's not only, peptides are amazing, but it's you have to understand what peptides are, and you have to make sure that you're getting them from a quality source. That's because there's a lot of scam peptides now, because peptides can't be, the FDA can't, they're not a medication. Okay, so let me explain what peptides are before I go any further. I love peptides so much. It's like my favorite new holistic therapeutic. So peptides, your body makes peptides. Your body makes GLP-1. It makes MOTS-c. It makes all these, your body makes peptides, okay? So when you take a peptide, what you're doing is you're helping the signaling. So peptides signal. All peptides are amino acids that help with the signaling. We have many different signals that our bodies do on a daily basis. But when you have one of those three biological breakdowns, the signaling is not working. It's just not working anymore. And that's where the symptoms come in. And then that's where the doctors say, put you on a drug. And then the drugs make it worse. Then you just get worse. So peptides signal, medications force. Big difference. Your bodies don't make medication. Your bodies make peptides. So what you're doing when you take a peptide is you're fixing the signaling. Nobody's ever died from peptides. You can't, there's no dangers in peptide at all. There's not any dangers in peptides because they're natural. Medications, not so much. So what I try to do is I try to educate my clients to get them off the medications. That's the most important thing to me, is get them off the medications, because they're not ever going to feel good, and they're never going to be able to be on them long, be able to reverse or cure anything on medications. You can't. Now, you can treat it. You can manage diabetes and be on medications and manage your diabetes, but why do you want to manage it with the risk of it risk? You always have that fear that's always going to come back, because the medications don't reverse. They don't cure. They treat. So the peptides, they signal, medications force. So I love peptides. So peptides are the new, they're not medications. Peptides are the new miracle. They're like a miracle. They're a miracle, a compound that does so much in your body. So there is one peptide I'm a big fan of. I can't even say it because I'll get banned. But it's called retatrutide. That is the peptide that I've been doing a lot of research on. I have my clients on. I have been on it, and there's a reason why I've been on it, and I'll tell you why. But this one is a triple antagonist. So when your doctors tell you to go on Ozempic or semaglutide or tirzepatide, or you want to run, because they are not the I want to just call it the holistic peptide. Okay. So what the triple agonist means for retatrutide, what it means is that there's three parts to it. There's three-part peptide. So it's not just GLP-1. So there is a GLP-1 in it, but it's it's such a small dose. And it's not like Ozempic. It's not mixed with other things. So it's a small dose of GLP-1. But here's the key. It's combined with GIP and glucagon. And that's what makes the magic, because now you have a triple agonist, and it's a very powerful peptide in preventative medicine, because it includes all these three molecules that activates those different receptor systems. You need all three. The glucagon signals and activates metabolic sensing. It's like a switch in the cell. It restores mitochondrial dysfunction and metabolic signaling, like insulin resistance. So it's very important that you understand what this compound does. It's not a medication. It restores insulin sensitivity. It helps the hypothalamus to respond better. It has better pancreatic signaling. You can expect cellular response, systemic response. It improves your liver function. So if you have fatty liver or liver fibrosis, this will cure it. And it also improves your brain function. So it will cure, and I say the word cure because it will. It will cure fatty liver. It will cure liver fibrosis. It will cure type 2 diabetes. Now, listen, I know how to reverse diabetes without peptides. I've been doing that for, many years, but adding the peptides now to it will just make the process, the reversal process faster. So type 2 diabetes, insulin resistant, triglyceride, and bad LDL. So, you always want, your doctors always want to put you on stupid cholesterol medications. They don't even know how to read a cholesterol lab. But the triglycerides are what we focus on, right? Because you don't want high triglycerides. So this compound does it it just gets rid of it. It fixes it. It annihilates visceral fat. You guys know visceral fat is the fat that's around your organs. It's the fat that your body accumulates to protect your organs from bad things. But visceral fat is the most dangerous fat. And this compound annihilates it. It helps with your neurological health. So if you're having, symptoms of neuropathy and brain fog, and it just fixes it. Cancer cell reduction, it causes the cancer cells to go in apoptosis, and systemic inflammation is 100% fixed with this compound. Okay. So peptides, especially retatrutide, is a longevity miracle. It represents something the pharmaceutical companies do not want you to understand, because the human body doesn't need more medication. It needs better and fixed signaling. So peptide signal medications force. The doctors and the pharmaceutical companies will always want to keep you on medications because that's where they make their money and that's where they profit. They don't profit from peptides because they can't, because peptides are a natural compound. They're trying to, trust me. They're trying to cut off, especially practitioners like me who are promoting it. They're trying to cut us off because they're seeing all of us get such amazing results. Now, I want to share my story, why I started using peptides. So I've been researching them for about 2 years and just started playing around with them last year, 2025. Well, in 2025, I moved to Florida in 2021, and we lived in this other house for 4 years, and I started not feeling very well when I was living at that place, not really knowing why. I just figured, change of scenery. I wasn't sure. I was doing my detox cleanses and stuff. But what I found is I had mold in that house. And I was living not knowing I had mold for a year. So I was breathing in all these mold toxins, and it gave me mold toxicity. Then in 2 years, I gained 25 pounds. And then after I found out the mold, so I had visible mold, and then we did, remediate. And then I did, all the mold was gone from that house now, but I still had the damage to my cells, right? The 3 biological failures, systemic inflammation for me caused by the mold, and insulin resistance, probably a little bit of that because I gained 25 pounds. And that wasn't my eating, and it wasn't my exercise. I eat right and exercise almost every day. So for me to gain 25 pounds, I'm like, okay, something is wrong, right? So that's when I started researching what toxicity am I being exposed to. So long story short is I was like, for a year, I tried to get the weight off, doing everything I knew. And I'm like, what is happening? And so that's when I started like, well, there's got to be something about peptides that can maybe help, because I knew it was the mold. So I detoxed from the mold, got rid of the mold, but the weight I wasn't able to get off. So that's when I started learning peptides. So I started on peptides last year, but Retta, I just started on in December. I've been on a couple other, so there's different types of peptides. There's 3 categories, I like to say. One is an anti-aging. So it's like you feel like you're aging in reverse, right? Like you can do a certain peptide protocol, and it's like good for, like collagen production and wrinkles, and you just feel youthful and you feel younger and you look younger. And then you have the weight loss, which is fixing, those 3 biological things. And you have the weight loss kind of protocol peptides. And then you have the muscle building kind of peptides that you can go on if you're working out and you want to do it in the right way, So I did the middle one, and I did the anti-aging one first, some of that, and I'm still experimenting with some of that. But I want to show you a picture because like I said, I tried for a year to get that toxic mold weight off, and I couldn't do it until I went on this. And this picture I'm showing you was from the picture, the one on the left is in October, and I was still doing the anti-aging, but in December is when I started the Retta fixing my mitochondrial damage peptide. And look at the difference. This is in 3 months. This picture is a 3 month time frame. Are you ready for this? Yes. The picture on the left, I just looked at that picture and I'm like, this is not me. This is toxic weight that is was a part of my mold exposure, and I need to get it fixed now. And then this picture was just taken last week, the one on the right. Look at the difference. I'm down quite a few pounds. I'm still not 100% where I want to be. I'm just a few more pounds, but even it's made such a difference in how my body feels, how it's healing. The mold toxicity, you guys, and mold is a bad thing. And a lot of you have mold exposure. You might not even realize it. But there's, mercury exposure, like if you got fillings, and I mean, there's so many things that we're exposed to that, and especially if I have a very healthy body. And so when I get exposed to stuff like that, it tries to protect itself. So that weight gain, I knew the weight gain was from something it was trying to protect me from. And so with you guys with diabetes, the same thing. When you're putting on all this weight, your body's trying to protect you, and it's not managing blood sugar right. You have systemic inflammation, your insulin's high, and your body doesn't, the last thing your body wants to do is lose weight. So this peptides as a part of a three system there, it will fix it. So I am a big fan of it, and I am going to be offering you guys an opportunity to do a call with me. And if you want to become a part of my peptide community, I'm just opening up some programs for that. And I will leave the information here at the end of this call on how to learn more about that. But what I want to do now is I want to take, if there's any questions you guys have, I'm going to look through the chat here and see if there's any questions. And then if anybody wants to actually come on and talk to me and ask me a question, I can bring you on. So let me look here. Okay, let's see. Hi Deb. Hi Denise. Let's see. Hi Tracy. Okay, so somebody's asking me, is it too late if I've been on Ozempic for 2 years? Can I still be okay? It's a great question, Clara. Listen, yes, but the goal would be, I mean, here's my honest advice for you. Get off of it, but you're going to need some help. And I would set up a call with me so that I can give you the best strategy to do that. And I want to know from you, are you on it for weight or were you put on it for your diabetes? Can you let me know that? Oh, Deb, I miss you, Debbie. Diabetes. Okay. So, and let me ask you this, has it worked? Are your numbers better? Are your numbers better? Yeah, see? Yeah. So this is where your doctors have failed you. They've failed you. And yes, there is hope. There is a way to reverse your diabetes, to get you off these medications. And it's going to require you to be brave enough to set up a call with me. That's what I would say. So yeah, so Claire, perfect. I'm gonna at the end of this call, I'm gonna you can actually go to call with Teri. All of you guys, I'll put this in the link here. If you go to call with Teri.com, Teri.com, callwithteri.com. That will lead you to my calendar, and then you can set up a time to book a call with me, and we'll just chat. And so, yeah, I have a very, very good diabetes process that will include peptides as a part of the process. So don't give up hope. Just understand that you have control. You don't have control when you work with your medical doctor. And I'm going to say this with all the love in my heart to all of you guys. And I know some of you worship your doctors, and your doctors might be the nicest people in the world, but I'm telling you, they don't know how to help you. And it's funny how you will see your doctors twice a year, right? And when I talk with my clients, I talk to them almost every day because you can't get better with somebody who doesn't understand your situation. How can your doctor understand your situation if you see them twice a year? And the bad thing to that too is that I understand doctors are busy and they have all hundreds of clients and they don't have the time. I get all that, which is why I only take so many at a time too. I mean, I kind of I my practice is different. I only take so many at a time, so I can give everybody the attention that they need. But there is hope, and if you guys are in my Facebook group, you can also go to, let's see, no, I think you can go to teritv.com, and that is my YouTube channel that gives you many examples of women who have reversed their diabetes and or have gotten better. So yeah, I mean, that's some research that you guys can all do.